Hi everyone, welcome back to our channel. Today we will discuss about the most important MCQ for the all nursing exam. Let's start. The most common cause of hospital acquired infection is option A virus, option B fungi, option C bacteria, option D protozoa. The answer is option C bacteria. Bacteria is the most common cause of hospital acquired infection. Especially the gram negative are the most frequent cause of the hospital acquired infection due to invasive procedure. Due to invasive procedure. Invasive procedure. Next. Normal urine output in an adult is option A 10 to 20 ml per hour, option B 13 to 15 ml per hour, option C 100 ml per hour, option D 200 ml per hour. The answer is option B 30 to 50 ml per hour. Because minimum acceptable urine output is greater than 30 ml per hour, indicating the adequate renal perfusion. So the answer is option B. Next, the antidote for the heparin is option A vitamin K, option B protamine sulfate, option C naloxone, option D atropine. The answer is option B protamine sulfate. Protamine neutralizes heparin by the forming a stable complex. So the answer is option B. Next, first priority in a patient with the burns is option A pain management, option B fluid replacement, option C airway maintenance, option D infection prevention. The answer is option C. Option C airway management, because we follow the ABC rules: airway, breathing and the circulation. Airway, breathing, next the circulation. So the answer will be option C. After the C, the airway maintenance, then we have to do the fluid replacements. In the fluid replacement, we used the Parkland formula. Parkland formula. What is the Parkland formula? Parkland formula: 4 ml into body weight into TBSA. TBSA, total body surface area. Next, the most sensitive indicator of hypoxia is option A cyanosis, option B tachycardia, option C restlessness, option D low SpO2. The answer is option C. Restlessness is the most sensitive indicator of the hypoxia. Early hypoxia affects the brain. Then it's come the restlessness and the anxiety occurs the first. After that, second it's occur tachycardia, but first it's restlessness. So the answer will be option C. Next, the Glasgow scale assess for pain level. Option B consciousness, option C reflex activity, option D motor strength. In the Glasgow scale assess for the consciousness. The answer is option B. In the Glasgow scale, there are the three components is there: EVM. E for eye opening, E for eye opening, V for verbal response, M for motor response. The numbering is 4, 5 and the 6. Total Glasgow Coma scale GCA score is 15. Highest and lowest is high and low is the 3. If patients came less than 8, the point is late, it indicates the coma, deep coma. Next, normal pH of arterial blood is option A 7.20 to 7.30, option B 7.30 to 7.35, option C 7.35 to 7.45, option D 7.45 to 7.55. The answer is option C 7.35 to 7.45. Next, the base side of IM injection in the infants. Option A deltoid, option B dorsogluteal, option C ventrogluteal, option D vastus lateralis. The answer is option D vastus lateralis. Muscle is well. Muscle is well developed and free from the major nerve injury. So we used for the IM injection infants vastus lateralis, for the adult ventrogluteal. So the answer will be option D. Next, which vaccine is given at the birth? Option A DPT, option B OPV, option C BCG, option D measles. The answer is option C BCG. BCG protects against the severe tuberculosis. In general, we are giving the OPV also, OPV, BCG and hepatitis B. But there OPV and BCG is there, but OPV dose 0 is not mentioned. OPV 3 dose is there, 0, 1, 2 and 3. 0, 1 to 4 dose is there, but here they already mentioned the BCG, so the answer will be option C. Next, ideal position to prevent the aspirations. Option A supine, option B prone, option C lateral, option D Fowler position. The answer is option C. Sideline position prevent the aspiration and the secretion, so the answer will be option C. Next, drug of choice for anaphylaxis is option A dopamine, option B adrenaline, option C hydrocortisone, option D atropine. The answer will be option B adrenaline or epinephrine. Both are the same. Another name is epinephrine. 1:1000 IM. They are giving in the anaphylaxis. So the answer will be option B. Next, normal respiration rate in adult is option A 8 to 10 per minute, option B 10 to 14 per minute, option C 10 to 20 per minute, option D 20 to 30 per minute. The answer is option C. For the adult, the respiration rate is 12 to 20 per minute. So the answer will be option C. Next, most reliable method of hand hygiene is option A soap and water, option B alcohol rub, option C antiseptic solution, option D plain water. Most reliable method of hand hygiene is option B alcohol rub, because most effective unless hands are visibly solids. Next, the normal platelet count is option A 50,000 to 1 lakh, option B 1 to 2 lakh, option C 1.5 to 4 lakh, option D 4 to 6 lakhs. The answer is option C 1.5 to 4 lakh. Next, First sign of the shock is option A hypotension, option B oliguria, option C tachycardia, option D cold clammy skin. The answer is option C tachycardia. Heart rate increase early to compensate. When the shock will occur, suddenly the heart rate will increase. Next, which PPE is required for the airborne precaution? Option A gloves, option B gowns, option C N95 masks, option D face shields. The answer is option C N95 masks. Next, best indicator of effective CPR is option A chest expansion, option B carotid pulse, option C pupil reaction, option D blood pressure. The answer is option B carotid pulse. Next, the antidote for opioid overdose is option A flumazenil, option B naloxone, option C protamine, option D vitamin K. The answer is option B naloxone. Next, normal SpO2 level is option A 85 to 90, option B 90 to 94, option C 95 to 100, option D 100 to 105. The answer is option C 95 to 100 is the normal SpO2 level. Next, which vein is preferred for the IV cannulation? Option A femoral, option B basilic, option C cephalic, option D dorsal metacarpal. The answer is option D dorsal metacarpal because it is easily accessible and the least complications. So the answer is option D. Next, disease caused by deficiency of iodine. Option A rickets, option B goiter, option C scurvy, option D pellagra. The answer is option B goiter. Next, normal ESR in males is option A 0 to 5 mm per hour, option B 0 to 10 mm per hour, option C 0 to 15 mm per hour, option C 0 to 20 mm per hour. The answer is option B 0 to 10 mm per hour. Next, the best site for measuring the core temperature. Option A oral, option B axillary, option C rectal, option D tympanic. The answer is option C rectal. Next, which vaccine requires droplet precaution? Option A TB, option B measles, option C influenza, option D varicella. The answer is option A TB. Option C influenza. Option C influenza. Next, for TB we have to take the airborne precaution. Next, normal fasting blood glucose is option A 60 to 80 mg per del, option B 70 to 100 mg per del, option C 100 to 140 mg per del, option D 140 to 180 mg per del. The answer is option B 70 to 100 mg per del. Next, first vaccine introduced under the UIP in India. Option A OPV, option B BCG, option C DPD, option D measles. The answer is option B BCG. Next, which condition causes clubbing? Option A asthma, option B COPD, option C lung cancer, option D bronchitis. The answer is option C lung cancer. Next, Kussmaul breathing is seen in option A asthma, option B CHF chronic heart failure, option C diabetic ketoacidosis, option D pneumonia. The answer is option C, diabetic ketoacidosis. Next, the antidote for the benzodiazepines is option A, naloxone, option B, flumazenil, option C, atropine, option D, neostigmine. The answer is option B, flumazenil. Next, most common side of pressure ulcer is option A, hip, option B, sacrum, option B, sacrum, option C, heel, option D, elbow. The answer is option B, because when the patient is lie down, the most of the position they are lying in the supine position. So most point to pressure ulcer is the sacrum part, sacrum. So the answer will be option B. Thank you everyone. Please like, share and subscribe our channel.